Question 156. Drop in academic performance, unexplained absence from school or college, lack of interest in personal hygiene, isolation, depression, fatigue, aggressive and rebellious behavior, loss of interest in hobbies, change in sleeping and eating habits, and fluctuation in weight and appetite. How many of the above are common warning signs of drug and alcohol abuse among youth? Youth is a very critical phase in life of an individual. It is a bridge between childhood and adulthood. Also during youth, a person is experiencing various biological and psychological changes. So it is a very vulnerable phase. So adolescence में क्या होता है? Out of curiosity, excitement and experiment, the person start using drug and alcohol. However, with repeated use, the person became addicted on drugs and alcohol. अब ड्रग्स एंड अल्कोहल की इतनी लत लग जाती है दैट पर्सन लॉस्ट फोकस फ्रॉम डिफरेंट स्फेयर्स ऑफ लाइफ लीडिंग टू अ ड्रॉप इन देयर एकेडमिक परफॉर्मेंस, अनएक्सप्लेन्ड एब्सेंस फ्रॉम स्कूल एंड कॉलेजेस, क्योंकि उसको पता ही नहीं है कि उसे स्कूल जाना है नहीं जाना, वो ज्यादा इंपॉर्टेंट नहीं है, उसके लिए ड्रग्स और अल्कोहल ज्यादा इंपॉर्टेंट हो जाती है. These person, they become isolated from their surrounding environment and they do not care about anything in their life, including their personal hygiene, surrounding people or their relatives and friends. Since they become isolated from their social life, these person, they suffer from depression also. And various drugs, they cause side effects like fatigue, loss of appetite, and these drugs, they affect the central nervous system, thus affecting our sleeping and eating habit. और जब इन लोगों को ड्रग्स और अल्कोहल नहीं मिलता है, so they turn out to be a very aggressive and rebellious. So all these are common warning signs of drugs and alcohol abuse among youth. So correct answer for this question is option 2. So let's proceed to our next question. Question 157. Read the following statements. A is given: smoking increases carbon monoxide content in blood and reduces the concentration of heme-bound oxygen. This is correct. Smoking increases carbon monoxide content in blood, and as a result there is a decrease in concentration of heme-bound oxygen, leading to an oxygen deficiency in body. So statement A is correct. Statement B is given: withdrawal syndrome characterized by anxiety, shakiness, nausea and sweating develops when use of drugs is resumed again. This statement is incorrect because withdrawal syndrome occurs when use of drugs is discontinued. With repeated and excessive use of drugs, a person becomes so dependent on drugs कि अगर drugs नहीं मिलता है, so its body cannot function properly. As a result, the body exhibits various withdrawal symptoms like anxiety, shakiness, nausea and sweating. So this statement is incorrect, stating withdrawal syndrome developed when use of drugs is resumed again. Statement C is given: AIDS and hepatitis B are common among the person who take alcohol and smoke regularly. This is incorrect because AIDS and hepatitis B are sexually transmitted diseases. They are not common among the person who take alcohol and smoke regularly. They are common among drug abusers or person who perform unprotected sex. So, statement C is incorrect. Statement D is given: enlargement of prostate gland and reduction of size of testicles is common in males who take anabolic steroids. So, this is correct. One of the side effects of anabolic steroids in male is enlargement of prostate gland and reduction of size of testicle. So, in the question it is asked how many statements are correct. So, there are 2 correct statements, making option 3 as the answer for our question. So let's proceed to our next question. Question 158. Multiple ovulation embryo transfer technology, that is MOET, is a program for herd improvement. In this method, a cow is administered hormone with mainly to induce super ovulation. तो अगर हम MOET की बात करें तो in MOET a cow is administered hormone with FSH-like activity, that is follicle stimulating hormone, to induce follicular maturation and super ovulation. As a result, instead of 1 egg which they normally yield per cycle, they produces 6 to 8 eggs. So super ovulation हुआ, and then this cow is mated with an elite bull or is artificially inseminated. Afterwards, the embryo at 8 to 32 cell stage is not surgically recovered from this cow, and that embryo is introduced into a surrogate mother. अब जो further development of embryo है वो surrogate mother में होगा, and the genetic mother is free for another round of superovulation. This MOET program is used for herd improvement, increasing milk yield, and improving the quality of meat. So in the question it is asked, in this method a cow is administered hormone with FSH-like activity to induce superovulation. So the correct answer for this question is option 3. Talking about the rest of the option first is given progesterone-like activity. Progesterone तो ovulation के बाद बनता है और इससे super ovulation नहीं होता है. So this cannot be an answer. Option 2 is given prolactin-like activity. Prolactin induces the formation of milk. So this cannot be an answer. And option 4 is given oxytocin-like activity. Oxytocin, it is required for the parturition. So this cannot be an answer. So let's proceed to our next question. Question 159. Hisardale is a new breed of sheep developed by crossing Bikaneri Eves and Merino Rams. This crossbreed was developed in Punjab. So the correct answer for this question is option 2. So let's proceed to our next question. So question 160. Consider the following animals. So in the question it is asked, how many of the above can be improved by the use of MOET program? It is multiple ovulation embryo transfer program. So by using MOET, cattle, sheep, rabbits, buffaloes, mares can be improved in terms of their milk yield and quality of meat. However, katla, rohu, hilsa, sardines, mackerel and pomfrets, they are fishes, and fishes, they can be induced to produce multiple eggs, but embryo transfer is not possible in fishes, so they cannot be included in the category. And apis, which is honeybee, and in insects, MOET cannot be done. So 5 of them can be improved by use of MOET program. So the correct answer for this question is option 4. So let's proceed to our next question.